Now, the withdrawal of donor funding through USAID under former US President Joe Biden and now currently US President Donald Trump has left Kenya's healthcare system grappling with major challenges. Programs supporting HIV and TB treatment have been severely impacted, prompting national and county health officials to convene in Naivasha to explore alternative funding solutions. Our reporter, Willie Dennis Njiru, has more on how the government is navigating this funding gap.
Approach to addressing systemic.
Amid the current crisis facing the country due to the suspension of donor funding, health stakeholders are urgently working to reorganize efforts and ensure cutbacks.
And what we are trying to do now is to reorganize our prevention program so that it's delivered within the national systems. And some of the national systems include education system, our national system, county system include our religious platforms.
The decade-long support for health resources may face a worse situation once the stop orders take effect, requiring a more integrated approach to deliver without jeopardizing the progress made. This is proving to be a complex challenge for the county health officers.
We know that the U.S. government contribution was large in this area. However, we are going to look at the other funding streams and see how we reorganize ourselves. The main message we have today is for the patients that they should continue taking their drugs. We don't anticipate a time that we will not have drugs.
On these particular drugs, they must be religiously taking them for the purposes of reducing the infection in the communities, and also at the same time take up those particular messages of reducing the infection.
The National Syndemic Disease Control Council NSDCC CEO Ruth Marsha has emphasized that this is a critical moment, one that requires a holistic approach. She called for the increased use of condoms and commercialization of these products in the private sector as essential preventive measures.
To embark on additional distribution so that everywhere we have part of this team that is joining us today been able to provide condoms for those vulnerable populations. We are also looking at total market approach. Those who can pay for condoms, we are encouraging them to also continue using the private sector condoms.
Regarding TB and ARV drugs, Marsha stated that there is currently no major challenge as procurement from the government and the Global Fund through KEMSA will sustain the supply for some time.
Currently in the country, we have enough ARVs that are sufficient, and there's no need for the panic moment as of now. We know that we had ARVs in the country that are supported by the US.
Reporting for TV 47 from Naivasha, I'm Willie Dennis Njiru.